Good afternoon. We are so glad you're able to join us today for this special webinar hosted by the National Keratoconus Foundation. I realize we're competing against the President's Keratoconus Task Force news conference, but I appreciate all of you who have decided to listen to what we've got to say. Our focus is going to be on keratoconus and coronavirus. So if you have any questions of general pandemic questions, we're not here to answer those. We're going to stick to eye health and what's going on here. My name is Mary Pruden, and I'm the director of the National Keratoconus Foundation. As most of you know, we are an education and an outreach program located at the University of California, Irvine in Orange County, California. We've got the slides up today with a beautiful beach scene of Orange County, and the beaches are all empty, just like I'm sure the streets in your town are also deserted. Most of our campus and our medical center is closed down, except for urgent and emergency cases. So Taylor Young, who works with me at NKCF, and I are both working from home. And so if you have, we apologize if there's been any delay in trying to get hold of us or with your requests or your inquiries, but we're doing the best we can, just like all the other businesses and services that you interact with. I've got a couple housekeeping notes before we get started. First of all, we had a family symposium that was scheduled for May 30th in Columbus, Ohio, and regretfully we've had to postpone that. That will take place sometime next spring, and we're trying to arrange a date right now. But if you live in the Columbus, Ohio area, we hope you'll join us, and so keep an eye on our website for the dates that are available. Our webinar series, which many of you listen to and participate in, is ongoing, and we have a talk that is scheduled for April 21st, just a couple weeks from now, and that is going to be Drs. Clark Chang and Biren Meg Parra from the Wills Eye Hospital in Philadelphia, and they're going to be talking about, so you think you need cross-linking. That should be pretty informative. They're going to go over treatments and answer some questions about some sort of conflicting things that people may have heard about cross-linking and sort of give an expert's view. So that's something to watch out for. You can sign up for that on our website, and that's April 21st. So before we get started with our speakers today, most of you have already attended one of our webinars. All your voices are muted, so you can't ask questions directly to the speakers, but you do have a box on your computer screen where you can type in your question, and we will download those. And if there's time, we'll try to get the experts here to answer them. And remember that the doctors can't diagnose your own personalized questions, but if you have a question that you think that other people will also be interested in hearing the answers, I think we'd be more than happy to answer those. If you do have a question about your own eye health, please go see your own doctor. So today's...
I'm not sure why.
Oh, hello? Let's see. Who can't?
The audience. They're writing that they don't know if it's started.
Okay. All right. I'm hearing that there is
let's see.
I'm hearing there's problems with the audio. Can my speakers hear me?
Yes.
Okay.
I can hear you on the phone.
Not on the computer, or not. Let's see. We're going to try to do enabling muting controls. Do I want it? Should I try that?
Yes.
Sorry. That's okay. Oh, all right. Somebody's just sending us a message that they can hear us. Okay. So I guess there's some people who maybe have muted their own computer. Yeah. So we will keep moving on and assume that people can hear us. Okay. So today's talk Today's talk is a result of several emails that we've gotten here at NKCF the last few weeks from the American Academy of Ophthalmology, of Optometry, from the Scleral Lens Education Society, from a group called the Gas Permeable Lens Institute, which is a group of industry leaders, its manufacturers and its clinicians who are sort of keeping an eye on that. And they've all sent sort of interesting ideas and tips on how to deal with eye health in this time of pandemic. And I realize that a lot of patients aren't seeing some of this really good information that we're getting, because if you're not in contact with your eye doctor, you may not be able to, they're not able to give you this information. So today we are very lucky to have two doctors with us who have long-standing and special expertise in working with individuals with keratoconus. Dr. Stephanie Wu is an optometrist who graduated from the Southern California College of Optometry and then had advanced training at UMSL, the University of Missouri St. Louis College of Optometry. She is a fellow of the American Academy of Optometry. She's a past president of the Scleral Lens Education Society, and her career has really been devoted to fitting contact lenses on those hard-to-fit patients. She now restricts her practice to custom and specialty lenses on patients with irregular corneas and corneal disease, and she is the owner of the Contact Lens Institute of Nevada. Our other is Dr. Joseph Ciolino. He is an associate professor of ophthalmology at Harvard Medical School and a researcher and clinician at the Mass Eye and Ear Infirmary. He's a graduate of Georgetown Medical School, completed his residency at Albany Medical College, his fellowship in corneal disease at Harvard, and his interests are cross-linking corneal transplants, cataract, refractive surgery. He is an NIH-funded researcher who is doing work related to the creation of a contact lens that would be capable of delivering medications like glaucoma meds or antibiotics. That would be great if we had that available now, so you should get started on it. He sees patients at his offices in Andover and Boston, so I'm very grateful that they put some time aside to help out NKCF and to answer some questions. First, I'd like to hear from our two speakers about what's happening in their professional lives. Dr. Wu, are you calling from your office or your home?
Well, thanks, Mary, and thanks to the National Keratoconus Foundation for having me. This is such an honor, as keratoconus is such a passion of mine. And right now, I am speaking from my home. According to CDC recommendations, they recommended, due to the COVID-19 pandemic, all ophthalmologists and optometrists should cease providing any treatment other than urgent or emergent care. So I'm not seeing many patients except for emergencies at the moment.
Okay, so you're just going in as needed, but no regular office hours.
Exactly.
Okay, and Las Vegas is pretty much shut down as well. So it must be very eerie.
Yes,
living in Las Vegas.
If you see pictures of the Strip, it's pretty eerie because usually it's packed with cars and there's lights from all the casinos and everything is shut down. All the casinos are closed, and so the Strip is very, very barren at the moment. So it looks very, very eerie if you look up pictures of the Las Vegas Strip right now.
Yeah. Well, hopefully it won't be for long. Dr. Ciolino, are you calling from home or from the office?
I'm calling from home.
You are as well. Tell me what's happening at Mass Eye and Ear. Now, that's a specialty hospital that just handles, for the most part, eye care. What's happening there?
Yeah, it's a little unique here in that I think we tend to get more of those urgent and emergency patients than maybe some of the other practices. We currently, I still have my clinics, but they're filled almost exclusively. they are exclusively urgent and emergency patients. So, for instance, yesterday, normally I would see about a third of my patients have keratoconus, and the others have problems related to the cornea, needing transplants or maybe cataract surgery. But yesterday I saw nearly only corneal ulcer patients, and there was, believe it or not, 14 just in the morning that I saw. Yeah, so I think we're getting a lot of the very urgent emergency patients that maybe would be handled by their local doctors, but the local offices may not be staffed or equipped for dealing with these emergencies. Right.
And so you're deferring a lot of your regular patients to see these. So you've rescheduled sort of people who would come in for their annual exams and things like that, right? So you're just seeing urgent and emergency patients.
That's exactly right. Yep. Just patients who have corneal epithelial defects, corneal abrasions, infections, like severe infections. Those are the ones that we're seeing, ones that need to be managed on. They really can't go more than a week before they need to be seen again and the management changed. So those are the patients that we're seeing right now. In my clinic, we had cultures performed on ulcers. We had glue that we placed for corneal perforations that we had to do in our exam rooms. So there's really emergency cases that you can imagine are the ones we're seeing.
Okay. So, in order to manage the resources, like you said, a lot of places are closed. A lot of doctors' offices have pulled back. And certainly doctors of every specialty are now doing virtual visits or Zooms. I know I've gotten calls from my doctors who are saying, the doctor won't see you in the office, but will call you. So I guess my question is that something that works for ophthalmology and optometry? Dr. Wu, do you ever do a virtual visit?
That's a good question, Mary. So personally, I don't do virtual exams or telemedicine, but a lot of my friends, my other optometry friends that own businesses are doing telemedicine and helping patients exactly the way that you described, where they're evaluating things without seeing you in the office. So you would call, kind of tell the doctor what's going on, or their staff member, and then sometimes they'll look at some photos, they'll talk to you more about the case, and then determine if it's something that they need to go into the office to see you. And so some doctors are performing telehealth medicine at the moment. I'm not doing it myself, but a lot of my friends are.
I guess for a screen, it would be valuable to sort of, if you could answer a question, but I keep thinking that there's so much of ophthalmology is such close-up work that you really need to see that it's a little difficult. How about you, Dr. Ciolino? Are you doing any of the telemedicine for your patients?
Yeah, I've had a similar experience in that I have never done this before this week. It's not something that I was really thought was feasible or was necessarily a good idea, and that one of the reasons I went into ophthalmology is because the exam is such a crucial part of it. And unlike some other parts of medicine where maybe you're looking at lab studies or blood work or things like that, in ophthalmology, you really are truly seeing the eye. And quite frankly, most of the cases, it's a beautiful organ to look at. It's absolutely gorgeous. And we're lucky to be able to look at our patients and able to see pathology and explain what's happening to our patients by looking at it. But here we're kind of losing that ability, aren't we? By doing it over the phone or even in Zoom, because like you mentioned, it is a microscopic exam that we're doing with a slit lamp, and it's very important to have that. Not just a light, but it's a slit beam that goes through, allowing us to see multiple layers and different layers. Even the cornea has 5 layers, and we go deeper and look at the other tissues. So it's a very detailed exam that we're accustomed to doing that we're not able to do. But we are adapting and doing the best we can, aren't we? And so this week I did have a call with one of my patients, and I have many more scheduled in the weeks to come. So it's going to be something that's we're kind of forced to do. And looking at my schedule, I've identified patients that I think absolutely have to come in, like those are the urgent issues, and those that maybe I can handle by the phone. And so I'm imagining those that do best by phone are those who are maybe on medications and have symptoms that I can try to address. Maybe some patients who have dry eye or allergies and things of the sort that I can maybe prescribe treatments for them or offer advice for those type of things that are symptom related. For the ones that are not symptom related, that we have to actually do an exam for, it makes it a little more difficult, doesn't it?
Yeah, it certainly does. So I guess my next question is sort of for both of you about exactly what would you consider an urgent or emergency? What are those patients? Who are those patients that you want to see in person? Dr. Wu, what patients would you go into the office? Would you ask to come in and you would want to work on in this time where we're sort of only seeing patients who are sort of urgent?
Yeah, great question. So I would say anybody with a red eye, I would want to see, because like Dr. Ciolino says, you can't really diagnose something just by taking a picture or a video of the eyeball, because you need to see different layers of the eye to determine what type of medicine is appropriate for that patient. So anybody with a red eye, especially if they're a contact lens wearer, because the risk of an ulcer is very high. So you'd want to definitely see somebody that's got a red eye, painful eye, something in their eye. So somebody that got metal in their eye or sand or some of these other things that can come up for sure. And then things like sudden vision loss. You wake up and you can't see out of that eye, or things look very distorted in that eye. Flashes and floaters. If you start seeing flashes and floaters or a piece of your vision missing, these are all considered ocular emergencies, and you should definitely be seen by an eye doctor for some of those things.
Dr. Ciolino, do you have anything you want to add to that list of ones that you would want to see a patient in?
Well, that was fantastic. Soon? Yeah, that is absolute great. All of those were really on point. The other things that I'm just kind of thinking about my practice, and I have a lot of patients who have keratoconus that have, some of them go on to get acute eye drops. And so that's kind of a sudden vision loss and a white color of the cornea. It can be painful. So something like that, someone would want to come in for sure. Other situations.
Now, does that happen overnight sort of thing? Would somebody just wake up with it? Or is that...
Unfortunately, it does.
It does. Okay.
Yeah. It's sort of one of the things we want to avoid.
Sure. And you mentioned corneal ulcers. Can you sort of explain to me what, if I had a corneal ulcer, what would my eye look like? What would I be feeling? What are sort of the symptoms?
Yes, as was mentioned, decreased vision, redness of the eye, light sensitivity, discomfort, pain, foreign body sensation. Those are things that when we look for, perhaps looking in the mirror and seeing a white spot on the cornea, which is, you'd normally see the color of your iris, which would be brown or blue, but in this case you would see a white spot perhaps. And so those are some signs of a corneal ulcer. And I was going to say, a lot of my patients have corneal transplants, different types of transplants, but nevertheless, I would be concerned about either a suture being loose, and they would feel that in terms of they would feel a foreign body sensation, like something's in the eye. And the other thing that they would be concerned about is a rejection. And so things they would look for there would be light sensitivity again, decreased vision, redness. So a lot of these symptoms are and signs are similar between the different diagnoses. So that's why it'd be important to come in and have someone take a look.
Okay. Now let's talk a little bit about this COVID-19 that we're all sort of changing our lives over. Are there symptoms are there eye symptoms that are associated with the coronavirus? Dr. Ciolino?
Yeah, so there was just a publication just yesterday out of JAMA Ophthalmology, and it was out of China, and it looked at patients who were admitted, and it discussed kind of the signs that they were seeing for the patients who presented with eye problems. And it turns out 1/3 of patients who were positive with COVID-19 had eye problems. And in fact, those patients who had eye problems were the patients who went on to develop the more severe forms of COVID-19. So I think this is different than what we initially thought. You know, we're learning about this day by day. We're learning more, just in general about COVID-19, and I think it tends to affect the eye more than we appreciated. At least this was out of the study that was published out of China, and I think it was around 80 patients that was that they analyzed.
And what are the symptoms that are that these doctors were picking up, the eye symptoms that they were seeing?
Yeah, I think you could say it was mostly consistent with what we might see for pink eye. There was redness of the conjunctiva. There was swelling of the conjunctiva. There was irritation. And those were the majority of the symptoms. It wasn't a severe infection inside the eye. It was mostly the conjunctivitis type of scenario that we're used to seeing.
Dr. Wu, one of the things that has been a concern is can the COVID be carried in the tears? Is that something that people should, like, is that a fluid that's going to be susceptible to taking in the virus?
Yeah, so that's another thing that we are just constantly learning about, and they're publishing studies and different comments from some of the health officials from around the world on what they're finding. And so far, they're finding that the transmission via tears is relatively low. So, of course, we know that the coronavirus spreads through the mucous membranes and coughing, sneezing, and it's still really unclear whether the virus is actually spread through other bodily fluids like tears. But there have been some studies that show that the risk of the virus shedding in the tears is low, but it still remains a concern. So, you know, you wouldn't want to touch your eye and then, you know, touch someone else's eye. But that's not something that...
Okay, but if somebody sneezed and there was a droplet that made its way to the eye, is that a way that people might be concerned about it? Would I know if it happened? Would I be able to feel it? And is that a way that the virus might be transmitted?
So there's always this possibility that it can be transmitted through the tears. So somebody sneezed and then it got into your eye somehow. But the risk is generally low as what scientists are finding at this point.
Okay. All right. So it's not so much a way for the virus to get in as maybe the nose or the mouth. I guess one thing that we've been asked a few times is with people using so much Purell and hand sanitizer, what happens if you get Purell in your eye? Dr. Wu, have you had any complaints from your patients about?
Yeah. So it's really important that if you're using any sort of hand sanitizer or some sort of alcohol base, you have to make sure that it dries completely before you're handling your contact lenses, or if you had to touch your eye for some reason, because it's when the alcohol has not fully evaporated and the liquid hasn't fully evaporated off of your hands and maybe even on your fingertips and under your nails, and then that's what causes the burning sensation. So if you do happen to get some hand sanitizer in your eye, or you touch your eye too quickly after you put the hand sanitizer on, you need to flush your eye copiously with large amounts of water to try to rinse out the rest of the alcohol that could kind of damage the front surface of the eye. And you can try lubricating with some preservative-free artificial tears to try to lubricate that surface. But if there is more of an issue, the eye's really red, it's irritated, you may need to call your eye doctor so they can take a look and see what kind of damage is done.
Okay. In the worst case, there could be some damage, and so you'd need to have eye drops or some kind of a salve or something like that?
Yeah, so depending on what the doctor sees, if it has damaged the epithelium tremendously, then you might need to go on some different eye drops, maybe some antibiotics, maybe some lubricants, just depending on the extent of the damage.
Okay. All right. So do either of you have anything else you want to contribute as far as symptoms, ocular symptoms of the coronavirus that you want patients to be thinking about or to be concerned about?
Yeah. There's just two more things here that I didn't quite say, and one was increased tearing and discharge. So if one were to have increased tearing or discharge, I think that may be increased. And so if, it's allergy season right now, and I think a lot of people may have red eyes and they're concerned about that. I think that if you, if your eyes are itchy and they're just red, it's likely you had the allergies, particularly if you have, nasal congestion. However, if you have more tearing than normal and you have some discharge from your eye, I think that would heighten the concern for COVID-19, particularly if you have other symptoms that are consistent with it, such as the fevers, the malaise, sore throat, dry cough, those type of things. I think that would heighten your concern. And the other thing I would mention is that, when, we're speaking today, and things could be very different next week or the following weeks, and we're just learning more about this every day. So, it could be that the eye is unfortunately a very vulnerable conduit to getting the infection, and we just don't know about it. And so we're learning all the time. And so I think a certain measure of common sense is really important right now. And, wash your hands, don't touch your eyes, don't touch your mouth, don't touch your nose, those type of things.
Well, that's actually a good lead-in to one of the subjects that I wanted to talk to both of you about, and that is that there was a headline. There were several stories last week, and in fact, CNN had the story, "Do you wear contact lenses? You should switch to glasses to stop spreading the virus." And they had a story that was saying that wearing contact lenses increases your impulse to touch your face, and that, you should move to glasses because eyeglasses would offer some protection against airborne viruses. So I think there was a lot of concern in the KC community because there's a lot of people who have a hard time getting by with spectacles, that they don't get good vision, and that they really need their contacts and able to function. And so I think that there was a lot of blowback after this CNN story. And so I want to talk to Dr. Wu, who spends her whole life thinking about contact lenses and how to fit and how to work with keratoconus patients. How do you respond to sort of a call to stop wearing your contacts?
Yeah, so this is something I really, really wanted to discuss because I've gotten many phone calls and messages from patients that saw this article and are completely troubled exactly for what you said, Mary, that a lot of keratoconus patients depend on their contacts to function. So I will tell you what currently, April 3rd, what the American Optometric Association and the American Academy of Optometry, the Scleral Lens Society, and the Gas Permeable Lens Institute. So these are all organizations that are heavily researched with contact lenses, lots of experts with contact lenses. And all of these organizations at this moment recommends contact lenses to be a safe and effective form of vision correction. And we just have to be smart about it, right? So you want to make sure that you are hand washing properly. That is super essential. And whether that's wearing your glasses or contacts, you want to make sure that you are following the CDC guidelines on thorough hand washing with soap and water and drying with unused paper towels. And then patients that don't have access to soap and water wherever you are, making sure that you are using a hand sanitizer that has at least 60% alcohol. And so you want to, of course, avoid touching your eyes and nose, mouth, and you just like Dr. Ciolino said, just kind of some common sense things. But you also want to make sure that you are following the guidelines of disinfecting and discarding your contact lenses as recommended by your eye doctor. So that's really important, because with a lot of contact lens patients, they will overwear their contact lenses. So these are patients that wear soft lenses and maybe they're supposed to throw them away every day, and they're keeping them or they're wearing them too long. You need to make sure you're taking extra precautions at this time and making sure you're throwing them away as recommended by your eye doctor. Now, with keratoconus patients, a lot of patients are in gas permeable lenses or hybrid lenses, which have a little bit of a different approach to replacement. And we just want to make sure that they're disinfecting the lenses thoroughly. And a lot of eye doctors at this point, including Dr. Tom Arnold, who I think is on this call, he recommends using hydrogen peroxide for disinfecting contacts, as do a lot of other eye doctors right now, because hydrogen peroxide has been shown to kill the coronavirus. So that is definitely something a lot of eye doctors are recommending for their patients. Another thing, Dottie Fidel, who's out of Italy, she had a really great article that just came out about how contact lens wear is completely safe at this moment. And a lot of the patients that are wearing glasses, they need to realize that the coronavirus can live on glasses, which are mostly plastic or metal or a combination of the two. And the coronavirus can really survive on that up to 9 days. So we need to be encouraging proper spectacle disinfection as well as contact lens infection as well. So that's something you can consider. And then I just read something from Dr. Christine Sin, another expert in contact lenses, and she kind of broke it down really simple, and I really liked the way that she kind of stated that if you've got a contact lens patient, maybe not a keratoconus patient, but maybe somebody with very, very, very mild keratoconus, and they can function without their contact lenses just fine with a pair of glasses, maybe to minimize the risk of touching their eye and minimizing that, then they can wear glasses. However, a lot of people that are wearing PPE, so PPE users, the contact lenses may be a little bit better for them because their equipment fits better on their face and on their head. So that's something that you need to consider. And then lastly, people that are wearing contacts for medically necessary purposes, such as keratoconus patients, it can actually be dangerous if they do not wear their contact lenses. I mean, a lot of keratoconus patients cannot even function. So for them to try to wear glasses in which they cannot even see out of and try to get around their own home could actually be a danger. They could trip, they could fall if they can't see properly. So in medically necessary contact lens wearers, a lot of patients rely on those to see. So a lot of the optometric associations are showing that it is completely safe to wear your contacts. You just have to be very diligent in washing your hands and caring for the contact lenses, making sure you're disinfecting the case, don't top off solutions, and just being extra cautious, but it is still a safe and effective form of vision correction at this time.
That's good to hear because it's a big concern, and we have definitely gotten some emails and some patients who are concerned about if they had to give up their contacts, they think they would have a real hard time functioning. I know a lot of keratoconus patients have to take their lenses in and out a couple times a day for fogging or discomfort or things like that. Is there any way to minimize that, or is it just you just have to pay attention to hygiene any time you're going to be touching, putting them in, or taking them out?
Yeah, so scleral lens fogging is a common problem, and sometimes it's due to the fit of the lens. Maybe they're working with their doctor right now and still kind of making micro adjustments to help with the fogging. Other times it could be the cleaning products they're using. Maybe their eye is more compatible with something else. Other times it can be from the filling solution. So what they're using to fill the scleral lens with. And so if all of those options have been exhausted, that's kind of the first place I would start. If those have all been exhausted, then, it's just something that some patients, they just have to take their lenses out a couple times a day or whatever it is that they're doing in order to see better. So if they are having to remove their lens, then you would just want to maintain that vigilant hand washing and making sure that you're doing it as safe as possible, including disinfecting your applicator devices and contact lens cases daily. There's also a video you might see where there's a way to kind of flush out the lens without having to remove it, and you can do that with the unused vial of non-preserved saline. There's a few videos online kind of demonstrating how to do that, so you're not actually taking the lens out. In my experience, some patients are successful doing it that way, where they're kind of flushing the lens without having to remove the lens. Other patients can't really get the hang of it. You kind of have to position the tip a certain way and be able to flush it out a certain way. So that's something that patients can try with the recommendation of their eye doctor. So that's something that you might look into as well. But I would just say,
if somebody wanted to look at some of those videos, are those at Scleral Lens Society's website or GPLI's?
I believe they're on both of the websites. And,
so that's sclerallens.org and gpli.info?
Yes. Yeah, go to both of those websites, and if it's not on there, I will find the link for you, Mary, and send it to you, and that way you can distribute to the listeners.
Okay. Now, I understand as one of your advisory roles from the GPLI, you have been in touch with some of the contact lens manufacturers, and is there anything that you can report as far as special things that they're doing a little differently now, or that information that might be interesting to pass on?
Yes, so I thought that was really important for the keratoconus patients listening today to know. So I did a survey for the contact lens manufacturers, and so those are the people that are making the contact lenses that the keratoconus patients are wearing. So they have the factories that are making the contact lenses, just so that everybody's clear. So I reached out to them and surveyed the different labs to find out if they were taking any extra precautions to ensure the safety of these medical devices. And we got so much great data, and it really has shown that the laboratories that are making your contact lenses are going to extra length to make sure that they are limiting the risk of coronavirus as much as possible. And some of the things include they have shorter work hours so that they're able to disinfect the lab more often. They have less people working per shift so that they're maintaining social distancing. Some of the labs don't allow people to work within 6 feet of one another to maintain social distancing. Some of the labs are even going to the length of taking the temperature of their employees before they enter the building every single day, which I thought was really going above and beyond. And so they are really trying to help with the situation as much as possible to help the spread of this disease. And they're taking extra precautions to make sure that it doesn't affect the product. There also, a lot of labs are actually offering shipping to patients directly instead of so if your doctor is not seeing you in the office, the doctor can order the lens for you and have it shipped directly to your home. And so it may not be an option for all of the labs, but most of the labs that we've talked to and surveyed said that they have that as an option. So if any of you patients out there that are worried that, oh no, I need to get another lens, or I'm not going to be able to go into my doctor's office, or you're worried about getting contaminated, then that's an option you may want to ask your doctor about. So the labs, they are just really going above and beyond to make sure that the quality of the product that they're getting to the keratoconus patients is very, very high quality and with as little risk of coronavirus as possible.
That's good to hear. Let's switch topics a little bit. Dr. Ciolino, we've gotten lots of emails from people who are concerned that their cross-linking procedures are being postponed. Are you delaying cross-linking at Methionine, or are you still treating those patients?
Yes, unfortunately, I am not. We're not treating those patients right now.
Okay.
So it's an elective procedure, and
right.
I think they deem that as something that cannot wait 2 weeks, and so this is something that can wait 2 weeks, and we'll probably find it's going to be delayed longer than that, of course. But it's definitely not an urgent procedure, so we are not performing cross-linking right now. That would Can
you tell me what you're telling your patients when you're postponing their surgery?
Yeah, so right now we're giving them alternative dates in May and June.
Okay.
So we are postponing them. We are giving.
But rescheduling as soon as you.
Exactly, we're rescheduling it, and none of us have a crystal ball here, and so we may end up pushing it back a little bit further, and depending on how things turn out. But right now, we're giving them the soonest available dates that we can, with the understanding that we just don't know what the future holds.
So the concern that we hear, and I'm sure that you hear it every time you tell a patient that you're going to postpone their procedure, is will this delay impact my vision, and what can I do to prevent progression during this time? Do you have anything that you can offer them, or do we just have to wait it out? What are you telling them?
Okay, so there's a couple different things. One is we're fortunate here, and so I would offer my patients reassurance that in general this is a slow, sort of insidious process. This is typically not something that happens abruptly and happens over the course of months to years, not days. So that's one thing I can say as a method of reassurance. And of course, I can't predict. None of us can. Oftentimes, my patients ask me to predict whether or not their cataract will get worse or the keratoconus will get worse within a certain time frame, and I don't have the ability to do that. But I can say that in general, it's a slow process. The other thing we can say is that there's several things. Well, there's at least one risk factor we know about that can be controlled, and that's eye rubbing. And so, if our patients can limit the amount of eye rubbing they do, I think that would help tremendously in terms of reducing the progression of their keratoconus. So that's one thing I think we can all do. And along those lines, many times our patients are rubbing their eyes because they have allergies. Ocular allergies is very common in our patient population. And there are over-the-counter medications that they can get right now that can decrease the symptoms of itch.
Can you give me a brand names, maybe?
Sure, I can give you some generics and brand names. So ketotifen comes in different brands, and that's something that's been available for many, many years. And that's the mast cell stabilizer that helps to decrease the inflammatory response from allergens. There's also Patanol, is something that we have previously been given by prescription, but just in the last several months that became available over the counter. So now there's a wonderful medication that's available over the counter that didn't used to be there. And so I would encourage them to use that twice a day. One of the two medications if their eyes are itchy. And there's also artificial tears. Something you can do is take particularly the preservative-free artificial tear, put it in the refrigerator, and anytime that you have that urge to itch your eyes, take it out of the refrigerator, put that nice cool drop on the eye, and that may help. So those are some things we can do to kind of decrease the eye itching. And for those of the patients in glasses, sometimes glasses are a nice barrier to preventing eye rubbing. And so that's kind of a reminder to not rub your eyes.
Would a patient who had a recent cross-linking procedure be considered especially vulnerable or higher risk than all their other sort of medical conditions? Does that sort of raise the level of concern over avoiding the virus?
Yeah, that's a good question. I don't think so. So,
okay.
So let's walk through that a couple of different ways. So if someone, at this point, we're kind of 2 or 3 weeks out after when we've stopped doing these stopped doing elective procedures. But if someone had a recent cross-linking with the standard epithelial off technique, at that point, they're at increased risk for infection until the skin heals. And so those type of patients I would see weekly until the skin is healed. Most of the time, they're healed within several days to a week.
Okay.
But in addition to that, our patients are typically placed also on steroidal drops, such as dexamethasone or prednisolone, Lotemax, and there's other types of drops. But nevertheless, medications that are meant to decrease inflammation, decrease scarring, and promote healing. Now, it's true that the systemic steroids are currently being avoided. It's thought that it causes worse outcomes as a result of the COVID-19. However, I don't think there's any reason to worry significantly about the steroid eye drop. In general, the amount that we get in our blood is very low. It's oftentimes not detectable. And also the frequency with which we're using them is typically not very high, probably 4 times a day at the max initially, and then decreasing after. So I don't think that there's a significant reason for concern with using the steroid eye drop. Perhaps if someone was positive for COVID-19, maybe out of abundance of caution, they would want to rapidly taper themselves off that drop or work with ophthalmologists to decrease it quickly. But in absence of a positive COVID-19 or symptoms that they think are related to that, I think they can continue the steroid taper as they normally would.
Oh, that's good to hear. Another sort of related issue is those patients who've undergone corneal transplants, and they're also concerned if are they at higher risk than the general population? Are they more vulnerable? And then I guess also those patients are also on medication, and is that something you're concerned of in light of sort of a COVID-19 status? Is that?
Yeah, it's a good question, and my answer would be similar to our cross-linking patients. Typically, our corneal transplant patients are only on a steroid, depending on when they had the transplant. But if they're several months out, they're not taking the steroid very often, maybe 3-4 times a day max. Most likely they're taking it just once a day. So I think that such a small dose of the steroid does not put them at higher risk for a immunocompromised state that they have to worry about problems related to the COVID-19. It's very different from other types of transplants. So you've probably heard in the news that patients who are immunocompromised are having worse outcomes, and people who are who've had solid tumor transplants, like a kidney transplant or liver transplant, like that, are on really different and very strong immunosuppressant drugs to prevent their body from rejecting that organ. But we're actually really fortunate in ophthalmology, and particularly with corneal transplants, in that the cornea, it has immune privilege, so that we don't need much to protect our body from fighting against the tissue. So just these steroids used once a day, oftentimes long term, is enough. And some patients aren't on any at all. So I don't think that should be a main concern for our patients with corneal transplants, no.
Okay, well that's good news. Is there anything that now? I guess one question that came up, which was sort of interesting, was are patients more or less vulnerable than someone who's had a recent corneal transplant versus the person who had their transplant 20 years ago? Is there should they be thinking differently, or are they sort of equally at risk and not at risk at the same time?
You know, I think they're equally not at risk.
Okay.
Good. I don't think
that's the best news we've heard. Yeah. Okay.
Yeah.
So
I think they're equally not at risk.
So we actually got two questions that Dr. Wu hopefully can handle, and Ansu asked, can you clarify the process of using hydrogen peroxide to clean lenses? Where to buy it? What formulation?
Great question, and I really should have clarified on that. There is at the store, and you can find it at most grocery stores and convenience stores in the area where they sell contact lens solution, there is specific solution, hydrogen peroxide solution that is created for contact lenses. And you'll want to follow the guide, the instructions on the back of the box. But basically, you take the lens out and you place a few drops of the special hydrogen peroxide into the lens on your hand and just kind of massage that around to break up some of the bigger proteins and lipid deposits. And then you place it in the special basket that it comes with, and then you rinse the lens for a few seconds on each side. And then there's a little case, and it's got a little line that you just fill up to the line with the special hydrogen peroxide, and then you screw on the case, and then it starts getting all bubbly because there's a little platinum disc on the bottom of the case that helps to neutralize the solution. And so most hydrogen peroxide systems recommend 6 hours or more. And then in the morning, the solution is neutralized. So you can rinse with non-preserved saline or some multi-purpose solution, and then put the contact lens in the eye. So it's important to know that do not use regular hydrogen peroxide that comes in the brown bottle that's at the store, because that is not medical grade hydrogen peroxide, and that can damage your lenses and your eye. So make sure you are getting the hydrogen peroxide that is specially made for contact lenses, and that is readily available in grocery stores and convenience stores. Another thing that I just want to point out is you'll notice it has a red tip or a red cap. That means that you should never put the hydrogen peroxide directly in your eye and don't rinse the lens with it before you put it in your eye, because that means that it's going to have an ocular effect, which means it's going to burn. So never put it in your eye directly. You have to use that neutralizing case for the hydrogen peroxide to get neutralized. So just make sure that you're never putting that directly in your eye, because that will burn and can cause all sorts of issues. And don't ever buy the brown bottle of hydrogen peroxide and try to make your own. You need to find the hydrogen peroxide.
Dr. Wu, can you remember or name some brand names that people might see that are the hydrogen peroxide solutions?
Sure. So there is one called ClearCare, and there's ClearCare Original, and there's ClearCare Plus.
Okay.
Personally, I prefer the ClearCare Original, but other patients, they like the ClearCare Plus. Maybe just check with your eye doctor and see if they have a preference for your specific lens type. And then there's also off-brand hydrogen peroxide systems, which essentially do the same thing. Like Walgreens brand, Walmart brand, CVS brand, name whatever brand. But it's always best to use name brand if possible, because you know exactly where the ingredients are sourced from, and there is a certain amount of quality control. But those other options are available if that's the only thing you can get.
Okay, we got another question for you, Dr. Wu. Alicia asked, what do you recommend that patients wash their spectacles with? So you had mentioned that.
Mm-hmm. Great question. So there's a variety of things out there. So you can use just traditional soap and water, and you would want to get it lathered, because the lathering is the thing that breaks down the virus. And also alcohol is really good. So sometimes the alcohol pads can work really well, or some sort of formulation of alcohol as well. And you want to make sure that if you are using spectacles and you are in an environment where you might be exposed, you need to make sure you're cleaning those multiple times a day. And something that oftentimes gets overlooked is your cell phone. The cell phone is a very hard surface, so it can harbor the coronavirus for many days. So it's really important to disinfect your cell phone as much as possible. And I'm wiping mine down with alcohol, several times a day, just to make sure that I'm killing off any viruses. So that's another thing that we kind of sometimes forget about, but we use our cell phones so much and we're touching it with our hands. So you want to make sure that you are disinfecting your cell phone as much as possible as well.
That's great advice. So we're almost at the end of our hour, and I think we've reassured everybody that wearing contacts is something can be done safely if you think about hygiene. And patients who are recently cross-linked or have corneal transplants are not at especially high risk, but that everybody should think about acting wisely during these times, washing hands, avoiding crowds, and all that sort of thing. So I want to end up with, both of you have lots of patients with keratoconus in your practice, and both of you have mentioned eye rubbing with these patients, and certainly you've mentioned it today, and you certainly must mention it when those patients are sitting in your chair. And I'm wondering if both of you can give us sort of the abridged version of what you tell patients as far as avoiding eye rubbing, how to do it, and why it's important, and all that sort of thing. So what do you tell your patients when they're sitting in your chair, Dr. Ciolino?
Well, I don't want to sound repetitive to a lot of the things that I mentioned before, but in addition to that, I ask the family members to help. It's kind of a team effort. And, I'll turn to the family who typically accompanies our patients and ask them if they see me eye rubbing. Sometimes people aren't even aware. They just say, I didn't know I did it. And the wife will say, oh, yes, you do. Or the mother or father will say that. And so, just kind of reminding our patients that they're doing it, and hopefully by doing so they'll stop. But that's one way that they can do it, in addition to the other ways of trying to avoid it that I mentioned earlier.
And Dr. Wu, do you have any tips that you offer when you're telling someone to avoid eye rubbing?
Yeah, so I tell patients that although it's not proven, many of the authoritative resources for keratoconus and a lot of research that's been done shows that eye rubbing might be one of the causes of keratoconus. And so that gets patients perked up right away that, oh, okay, so this may have caused me to get keratoconus, and it could also maybe make it worse. And so knowing that, just eye rubbing, even though they might just think, well, who cares? I'm just rubbing my eyes, no big deal. But when you tell them that there's a lot of research and things that have shown that it may cause keratoconus or make it worse, then they say, oh, okay, well, I really got to do something about it. So I always want to make sure that they understand why eye rubbing is not a good thing. And then some of the tips I always give is just like Dr. Ciolino said, is eye drops that can help with eye allergies. And I prefer some of the prescription strength ones. I think they're just a little bit more effective than over the counter, which you would expect. A prescription strength anything is going to be a little bit more potent. So I like to prescribe an ocular allergy eye drop, and there's many different choices out there. And then I love the artificial tears, the non-preserved artificial tears in the refrigerator that Dr. Ciolino mentioned is such a great tip. That provides a lot of relief. It feels so nice on the eye when the patients are putting it in. And even things like cold compresses. So you can put washcloth in some ice water, put it in like a little bag, and then just kind of put that on your eyes. And any times that you're feeling like you need to itch your eyes, that can help tremendously as well. And even sometimes oral antihistamines. So sometimes patients can just pick up something from over the counter that can help by helping with itching from the inside out. So now that we're entering into spring and some of the blooming, all the pollen and everything in the air can really cause some of these patients to really want to itch their eyes. So anything that we can do to help prevent them from itching their eyes is worth it to me. So sometimes that can be another tool in your toolbox.
The National Keratoconus Foundation, in our newsletter, we often run surveys, and we ran a survey recently with eye rubbing and cross-linking, and patients who'd had cross-linking reported, for the most part, that they were rubbing their eyes a lot less than they did before. And some patients, a small percentage, said that actually their eyes itched less, and that the cross-linking had provided some kind of relief. But the majority of patients said they were just more aware of it now that they've had the cross-linking, and so that they were sort of more aware of their eye and the fact that they touched their eye before. And like Dr. Ciolino said, a lot of them used to do it unconsciously, and while family members may see them rubbing their eyes, they may say that, deny that they ever do it. So, maybe just being a little bit more thoughtful during this pandemic and thinking about hygiene and washing hands and sort of, cleaning contact lenses and sort of, all sorts of eye health. Maybe people will be a little bit healthier going on. We're practicing this, and maybe they'll remember to rub their eyes a little bit less, because there does seem to be a high correlation with keratoconus. So I think we are at the end of the hour. I want to thank our speakers, Dr. Wu from the Contact Lens Institute of Nevada and Dr. Joseph Ciolino from the Mass Eye and Ear Infirmary. Both you guys did a great job in explaining it in terms that anybody can understand. That you brought some great tips and I think you reassured a lot of us that while we have lots of things to worry about, maybe our eye health is not something that is out of our control. I also want to thank all of the audience who dialed in today, and a copy of this broadcast will probably be up in the middle of next week. So if you want to listen to it again, or if you want to ask a family member or friend to listen to it, you can find it on our website, and there'll be a link there. So we appreciate you spending an hour with us. Join us on April 21st to for our next webinar, which is going to be on cross-linking. So you can also sign up for that webinar on our website. So thanks to everyone. Good afternoon. Stay safe, stay healthy, do what you need to do, and we'll get through this. Thank you very much. Bye-bye.